are just starting by making sure the face and the skin is completely clear of any dirt, debris, makeup, oils. Any kind of residual stuff left on the skin can cause discomfort, and it can also absorb some laser energy. So we just want to make sure that that's not going to happen at all during our treatment today. So we use a little bit of alcohol to prep the skin. It's just to make sure we get everything off. Again, we just can't let anything on the skin be absorbing any of that laser energy. It causes discomfort, the laser won't be as effective, and it can actually cause burns. We just use these tiny little goggles to protect our patient's eyes. During the treatment, some patients have said even though they have the goggles on, there will be a bright flash, especially when you get to their cheekbone area. It's just the brightness of the laser, it's nothing to be scared of. All right, and since our patient here, Terry, is a skin type 2, we typically would treat her starting on the face about an energy of 6. She typically gets spray tan, so we are going to bump that down just a little bit to be a little bit more careful for any leftover spray tan that might be like hanging out on her face. The coolest thing about this laser is it is safe for tanned skin. So what we're going to do here is hover that laser about an inch over the skin, and we're going to lay down 4 to 5 passes at this energy. And we'll keep that about 4 shots per 1 inch in that space. We usually like to break the face up into these 4 quadrants. It just makes it easier to keep track of your passes that you're doing, as well as making sure you're hitting each area with the right amount of energy the same way every time. You might smell some burnt hair, kind of a little bit of a burny smell during your treatment. That is just little hairs that we've hit. Any dark, thick, actual barbous hair we can treat with this laser. So if you have unwanted upper lip or chin hair and you're coming in for the rejuvenation, you're going to get that added benefit of the hair reduction as well. And that applies to any treatment. Acne treatment, melasma, rosacea, you are going to get that benefit of the hair reduction with every single one of those treatments. Now this area we do like to pay a little bit more attention to along the sides of the eyes where those glasses are. So we try to pull down a little bit while still maintaining that protection of the patient's eyes, but to be able to hit that little area on the temple that is usually covered. The forehead can be a little bit sensitive as well, so breaks are kind of sometimes recommended between, but if the patient is comfortable, you can go ahead and get through all of your passes and just get it over with a little faster. There's just not a lot of tissue to the forehead. But today we're going to do a small laser hair removal treatment on our patient Ray. He is a skin type 6. This laser, of course, is one of the only on the market that is able to treat patients of darker skin tones or Fitzpatrick types 5 or 6. It's really nice to be able to offer that to our patients. We're going to go ahead and get started. We're going to prep his skin, cleanse the area very thoroughly, dirt, debris, oil, everything off, and do a good little wipe scrub with some alcohol. Next, we're going to go ahead and get started with the treatment. We're going to use a tongue depressor just to outline the areas that he actually wants treated. So we're just trimming up his beard line. So we're going to use that tongue depressor to make a really nice sharp line for him across his jawline. Sometimes during the laser hair removal treatment, there will be some sparking, you'll see some plumes of smoke. That's all totally normal during this treatment, especially on men that get this. The smell of the burning hair can be a little bit intense, but that's totally normal, nothing to be worried about, and it actually just means the treatment is doing its job. We call it the smell of success. Post-treatment for laser hair removal is a little bit different than some of the rejuvenation. Again, there's still no downtime with this treatment, but some patients may experience some of a histamine reaction. It can be just little red and bumpy skin around the area that was treated. That's totally normal. A lot of patients say that it goes away within a couple of hours or at least within the day. You can apply a little bit of cortisone cream to help speed up that process. About 2, 3, 4 days after the treatment, we do encourage the patient to do some exfoliation. That encourages the hairs to actually shed out of the follicle. Sometimes there's no encouragement for that hair to come out, so it can get a little irritated. So we definitely recommend that exfoliation, and it will let the patient see the results a little bit faster that way as well, because they will see those hairs actually shedding out. And that's it for our treatment for today.